Welcome, colleagues, to our webinar on leveraging meteorological data for predicting climate-related health emergencies and strengthening preparedness and readiness. So we may have to leave a few minutes for some more of our colleagues to join, but you're very welcome. All right. Good afternoon, colleagues, and very welcome to this session. Today is another very exciting webinar that we shall be having today. With me are very distinguished experts in the topic. My name is Dr. Ibrahim Mamadou. I am a technical officer for operational readiness with WHO Afro hub at Nairobi. I also have with me a distinguished colleague, expert climatological officer with IGAD Climate Prediction and Application Center, Dr. Paulinho Omai. Also with me is Dr. Alan Mpire, Technical Officer, Risk Management and Preparedness at WHO Afro under the Emergency Preparedness Program. Also with us is Dr. Alice Ladu, a Technical Officer, Preparedness in Humanitarian Settings and Climate Change, also at the Nairobi Hub Emergency Preparedness Unit. We may have to give maybe one more minute for more colleagues to join, then we will go through the housekeeping rules. All right, so this is the beginning of a series of webinars on climate-related emergencies. Today's webinar's title is Leveraging Meteorological Data for Predicting Climate-Related Health Emergencies and Strengthening Preparedness and Readiness. Next slide, please. So, right before we start, we need to remember that this is a safe space in line with our organizations and the UN-wide code. Remember that this virtual meeting adheres to the code of conduct to prevent and respond to sexual misconduct, including sexual harassment, abuse, and exploitation. Next slide, please. So I'll talk you through about the microphones and cameras. So all participants have access to the show captions, Q&A, chat, reactions, raise hand options. As you can see on the screen, all of these are on your screens below. If you wish to take the floor, raise your hand and I, the moderator, will invite you to talk. When I do so, please activate your microphone and then you take the floor. Using the questions and the chat. So you can see circled in red at the top of this slide, the Q&A feature. Use this Q&A feature for questions regarding the topic and presentations. Remember, only questions in the Q&A will be answered during the sessions. Responses may occur live during the event or may be replied privately, that's directly or publicly, for the benefit of other attendees within the Q&A. Looking a bit lower is circled in red, the chat. So use this chat feature for general introductions and questions regarding things like IT or logistics. Do not use it to ask questions from the panelists. The chat may also be used by presenters to share important links, contact information, and so on and so forth. But all your questions, please direct them into the Q&A or else they will not be answered. Next slide, please. Also for captions, you can click on Show Captions and captions would appear on the screen. To close the caption, click Hide Captions on the right of my screen. You can see Hide Captions. Next slide. So recording material and feedback. Kindly note that by participating in this meeting, whether as a participant or as a panelist, we take your attendance as permission to record your contributions and share the recordings via various channels for continuous learning purposes. The session materials, including session recordings, will be shared with the participants in the days following the webinar. So by registering, that means you have given consent to be recorded. Next slide, please. Also to note, we do not have French interpretation or Portuguese interpretation. There's going to be subsequent dates sent out for other language sessions. So this has no interpretation function at the bottom. This is an English-only session from our presenters. So I'll quickly run you through the agenda. We are just doing the housekeeping session by myself. Next, we're going into a very interesting session on climate predictions modeling by Dr. Paulino Omai, as I said, from IGAD. Following that would be assessing climate-related health risks profiles in countries by Dr. Alan Mpire, and that would be then rounded off by Preparedness and Readiness for Climate Change Impacts on Health by Dr. Alice Lado. That will be followed by a Q&A session, and we have explained how to ask questions. However, you can type your questions in the Q&A even while presenters are presenting, and the team will be looking through to answer typed questions asked in the Q&A. We'll finally have a very short closing remark, and then we shall end this session. Sounds very interesting, so please pay close attention and welcome everybody. Let's begin. I'd like to invite our first presenter, Dr. Paulino Omai, to please go ahead with his presentation. Dr. Paulino is an esteemed colleague and will definitely blow us away. Thank you.
Thank you very much, Dr. Ibrahim, moderator. And also, let me take this opportunity to appreciate the WHO Afro team one by one, and also give thanks to participants who managed to tune in for this very important webinar. Has been introduced by moderator. I'm Paulino Omai. I work with IGAD Climate Prediction and Application Center in charge of climatology. In simple language, climatology means a section dealing with the climate information from yesterday, then you are going back. By professional, I'm a meteorologist. Then later on, I did climate change at master's and PhD level. For the purpose of this presentation, which is concentrated on the climate prediction modeling in general climate models, I want to take you into account a very brief overview of climate prediction and model in general, then also give classification and example of climate models. Then again, also explain the component of climate models, which categories, from bigger one to smallest. Then also these climate models, which type of product being produced or data set. Once we are talking about meteorological data, this data set then translated into product in terms of early warning. So I want to give a seamless of this early warning component from model product. Then also explain more why this model are very important for health sector or health application. On the climate modeling in general, when you look at the climate prediction model, actually those models are using mathematical and computational techniques to simulate climate system. Looking into the climate system, it is itself a very complicated system where you have a component of land services and also component of vegetation, then component of ocean and atmosphere. All of them interact in one, and we name them as climate system. It's not one system, it's a system. Models use them and also to simulate the present and past and also future. Why we are doing that? Those models actually they're helping us able to solve a very complicated problem and also understand the complexity of the climate system, the different components for us able to predict the future. This model also are based on well documented. It's not just something cooked from somewhere. They have a mathematical formulas very clear. They're based on documentation of these formulas and also the steps for us able to simulate and navigate the energy transfer, mass also, and momentum within atmosphere, and interaction with the land, and also vegetation, ice component, and what's going on inside the ocean. All of them, they interact in a physical processes, where now you have to look at the grid. Every area for it to be represented by the model, every area on the earth should be represented by latitude.
Have we lost him?
Looks like we've lost the sound. Apologies, colleagues. We just give a few seconds for Dr. Paulino's connection to get stronger.
I think we have lost him.
Like it.
Yeah, proceed with mine. I'll wait for him.
We just hold on for a few seconds to see if you can establish reconnection. Our technical team in the back end is reaching out. Okay, welcome back, Dr. Paulino. Please unmute your audio.
Sorry, I was presenting and already I disconnected.
Yes, please.
Yeah, power went off in office suddenly, so I have to connect using the mobile bundle.
Okay,
Yeah,
should we share the slides from our end?
Yes, you can hear from your end, or also I can hear from my side if yours will take longer a bit. I may share from my side,
okay,
because now I'm using I'm using a bundle now. I hope it will be much better. Yeah, sorry. I think I managed to give overview on the content. Then I went with slide 2. I'm not sure if I finished that one or not. But let me just give, in this presentation, I give overview on the climate model and type of the model itself, then the component of climate model being used, and also the product being produced from this model, whether the data set or the product being translated from this data set, and also why these models in general are very important for the health application. If you look at the nature of the modeling itself, climate model that are based on the mathematical and computational techniques being used to simulate the climate system. If you look at the climate system, I mentioned the climate system as a main 5 component, where the component of atmosphere and ocean, vegetation, land, and ice component, all of them should be representing in the model for us able to talk about the climate system. This system also, when being applied on a certain point or location where there is a horizontal grid in terms of latitude and longitude, and also the vertical grid, all of them are very important in the modeling, where those grid play a significant role because there is variation of the climate condition from area to area. Those models, they've been used at least to solve very complicated problems, and also for us able to understand the nature of the climate system, which is a very complicated and complex system itself, where you have a component from atmosphere and interaction with ocean or also land, then ice. Those models are based on the well-documented physical processes. It's not just something being put in place without being documented. All formulas, the mathematical computation techniques behind this model, they are well documented very well. And also the physical processes are well documented for us able to simulate some component like energy transfer, mass, and also momentum. All of them are very captured in thermodynamical modeling for us able to see all of them represented in climate system. Then again, if you see the nature of these models, they are classified into 5 main categories. We have a general circulation model. In terms of climate application, some they name it as global climate model, GCM. For example, if you see the Intergovernmental Panel on Climate Change, IPCC, reports they've been produced every 5 years, they are using a couple model intercomparison, phase 1 up to now, phase 6. Now, in the next report, we are going to phase 7. This is a type of model. They have a very low resolution. Then the second type of the model itself, from the climate perspective, we have a regional climate model where the main component of climate system at the regional level will be captured. Like now, if we talk, for example, for East Africa, we have a Turkana low jet should be represented in the model, and that one will be captured very well in the regional climate model compared to global climate model. Therefore, the regional climate model has a higher resolution compared to global climate model or general circulation model. Then again, we have a third component of the modeling itself, where they're all component based on a statistical and empirical calculation, such as weather and also some machine learning based model. All of them, they depend on the statistical and empirical relationship for you able to see the main component. Then again, if you look at the example of the regional climate model, like coordinated codex itself is an experiment to navigate the climate condition as a national at the regional level. Then the third one also like Earth system model, such as National Aeronautics and Space Administration, NASA. Graded Institute for the Space Studies model, GIS, is an example of ECMS model. When you look at the couple ocean atmospheric models, such as a model from European Center for Medium Range Forecasting, weather forecast, such as the seasonal product being generated. And then again, the last one, based on the prediction in a short-term application, such as a model being used for the forecasting and near-time forecasting, or also could be seasonal to seasonal perspective, could be from 1 month to 3 months. All those components of climate model, they play significant role, and also different application. Every model has weakness and also strength. If you look at the nature and component of this climate model, all of them are based on atmospheric, such as a component of temperature, wind, moisture, and soil. All these components are very important, and also representing the ocean, such as sea surface temperature, is a component number 2. If you look at the component land surface, such as vegetation, soil, moisture, and cryosphere, ice, heat, all of them should be represented in the model. And all these components are very important if you are talking about the atmospheric model, which is going to be used in predicting any meteorological application for you able to generate this meteorological data. And then again, if you ask yourself, why they are very important really, these models? Putting into account, we have a frequency and intensity of outbreak of climate-related disease. Those models are very important for predicting this frequency and intensity in advance. And also you can simulate the pattern of outbreak of vector-borne, waterborne disease from past to present time and also in future. Those components of model also been used in multi-hazard monitoring system, which facilitate also early warning information at different level. And also this model will help in planning for the health intervention, where now we are talking about preparedness. When you do a planning based on the prediction, now you'll be able really to put suitable intervention in advance, where now we can talk about preparedness. If you look at the application of these models, basically they are applied in terms of climate monitoring, forecasting, and also sector like agriculture and food security. Then also on the water resources, on the health sector, environment monitoring in general, disaster risk management, climate security itself, coordinating mechanism from different perspectives, and also analyzing climate change in the long term. All of them are very important. Those models, whether GCM or regional climate model or empirical model, all of them are very important in this application, where the health sector, very important sector for it to be navigated through application of meteorological data which come from these models. If you look at the nature of a product can be produced and the data set from these models, you can get a data set from a meteorological data set from hourly to daily, and also from weekly, which is 7 days, and also decadal, which is 10 days. Then this information also could be produced from the monthly, some product also on the seasonal, which will start from 3 months. Then some of them could be also the long term, such as climate change. If you look at this timeless of this information, for example, the information from hourly to daily product from the climate prediction models, you will find them, they're very important in relief activities and also preparedness. Then also, if you look at the weekly up to monthly to seasonal, they're very important in preparedness planning. If you look at the long term in terms of climate change, this information are very important for strategic planning, where now you're able to plan in advance, whether for 10 years or more than 10 years, or also coming back into decadal, which is 10 years also. All of them are very important and also should be put into consideration when you are applying the models. Now, when you look at the nature of this model, they are very, very important, and they are providing decision makers with information which is useful and also could be a solution, such as the platform used in ICPAC. We name them as Hazard Watch. These Hazard Watch are actually the geospatial early warning application for East Africa in general. where we're able to support multi-hazard early warning, which is very important. In place, we have East Africa Hazard Watch, and also East Africa Drought Watch, East Africa Agriculture Watch, and also Flood and Drought. All of them are very important. Currently, we are working on East Africa Pandemic and Epidemic Watch. We're still in the process, but by end of the year, we may be in a process or in position to complete this watch. All of them are very important in multi-hazard early warning, which is very important for health sector. And also, this is a beauty of application of the climate model for decision making processes. This is one of the example of a product which is very useful for health sector. We name it as E-Distress Index, being produced using a WAF, which is a weather research forecasting model. This model also, this product been produced on daily basis and also 3 days and weekly. And then you are able to see now, like for example, now the E-Distress, which is very important in some heat-related illness, such as heat stroke or heat cramps. From here, you will be able to see very important, like nowadays, this week and next week, for predicting in South Sudan for temperature to be high. And then if you reflect them into the heat index, you find discomfort and also some risk into the heat cramps and heat stroke could be also seen in some areas in South Sudan and also coastal part of Tanzania and Kenya and Somalia. This model, they produce the data set, and this data set being plotted into the product, which is very important for early warning for health sector in general. Then again, the second example of the product, which is a total rainfall and anomalies, we will be able to predict in advance. Like, for example, this is what's going to happen from yesterday up to day 19 of February. So everyone will be able to see which areas exactly are getting good rain, which areas they are not going to get good rain, which areas also going to be warmer than usual. So this information on decadal or 10 days or weekly, they are very important for the health sector in general. And also this information they produce in ICPAC here on a weekly basis and monthly, then seasonal. Then also we have a long-term climate change information, which also can serve for very long planning in future. Then again, on the climate change, this is some of the product from the climate models, climate prediction model. You can see the temperature. Now, when people talk about the global warming, this warming is not a joke, it's a real. Like now, if you take the average of all East Africa, since 2020, most of the year, every year, we are getting warmer, while already, if you compare with the previous decade or previous years, our current period is warmer than before. And also, if you look on the projected future, what's going to happen in 2023 up to 2100, also this warming is predicted or projected to be more higher. And if you took on the if you take the Paris Agreement, East Africa in general has warmed beyond the Paris Agreement agreed values of 1.5 and even beyond 2, and also projected to be continue in the future, mean the warming is going to continue. And it is very, very important for you to see even from the map. The more we go to future, the map become red and more. Yeah, which is very important also for planning which areas they are getting more warmer than other areas. On application, they are very, very important. This model, they are very important for health-related emergency and also preparedness and respond. Why I'm saying that? Because this information are very important, and this model product in terms of data set, meteorological data set from this model, they serve as early warning for climate sensitive disease such as respiratory illnesses and also vector-borne disease, whether the mosquito-borne or conducive environment for mosquitoes, where now the malaria, dengue fever, chikungunya, Rift Valley, all of them are vector-borne, they are related to climate condition, which is also very important component in knowing climate condition because they play significant role in conducive environment for mosquitoes. Then again, on the strengthening preparedness and readiness in terms of the healthcare system readiness, readiness. They are very, very important. These models play a significant role in the healthcare system readiness, and also stockpiling medical suppliers, very important, because you will be able to predict what's going to happen in next 7 days, in next 1 month, in next 3 months, next 10 years, next 1 year, then also in next 50 years. So it's very, very important for you as able to strengthen the preparedness and readiness, which is a very important product from a global model. And also some climate extreme like floods and landslide, you will be able to predict them in advance. Then now you will be able to prepare population against this extreme event. The third component also is a disaster risk reduction and emergency, which is very important, such as heat wave, drought, and community engagement, which is also very important product being produced through GCM or regional climate model data set. Also on the policy and decision making are very, very important component. And if you look at 1 to 4, all those components are very important for us able really to take into action based on the health-related emergency preparedness, strengthening the resilience of population, and also we're able to prepare more and more in terms of response. In conclusion, really, those climate models are very important because they're helping us also to anticipate in advance how to mitigate also climate-related risks. They are very important also in terms of early warning for climate-sensitive disease and also heat stress, extreme weather preparedness, and also some illnesses related to food security, food insecurity, malnutrition. Also, they're very, very important in disaster risk response and emergency planning in advance. And also looking into the long-term health policy and adaptation. All those models from the global model to regional model and sub-regional level, they're very important in long-term health policy and adaptation strategy. Thank you very much, and over to you, moderator. Let me give apology for internet to throw me out. Apology to all participants. Thank you very much. Asante sana, shukran jazilan. Over to you.
Thank you very much, Dr. Paulino. Even though we had that interruption, you managed to make up the time. We're very appreciative. So colleagues, please, as I said, your questions can be typed in the chat box, or you can wait for the Q&A session. But just as a reminder, you heard the importance of heat stress, of climatological models, which are important for predictions, important for planning and early warning. We can say our colleagues can see the future, and this is quite key for us in health planning. So to continue with our session, we're going to go into some of the health-related methods of assessing the risks. To do that will be Dr. Alan Impire. He will be sharing from his end very also equally exciting discussions. Over to you, Dr. Alan.
Thank you, Dr. Ibrahim. I hope I'm loud and clear. And thank you, Dr. Paulino, for that interesting discussion. So I'll talk about how we can assess the health risks and also profiles to be able to predict and effectively plan for public health emergencies that are related to the current climate change. I will share from my side. I hope it's visible. If I start, okay?
Please go ahead.
All right, so trying to remove these bars from my side. Okay, climate change remains a public health problem. It's a global health problem, and it's affecting a large population. It's estimated that about 3.6 billion people are affected and are highly susceptible to the current effects of climate change. It's common knowledge that women, children, older migrants and adults, displaced persons, people with pre-existing conditions are among those who are most vulnerable. Again, it's estimated that between 2030 and 2050, the climate change that is taking place now will cause about 250,000 extra deaths per year. This will be majorly malaria, diarrhea, heat stress, among others. It's also estimated that it will cause intensified health impacts from extreme weather events such as heat wave, floods, drought, wildfires, windstorms. You have seen this in the African region, you have seen this in other continents, and it's becoming a bigger problem. It's going to result in altered infectious disease transmission. This is already being seen. We are seeing new strains of malaria coming up. We are seeing new patterns of disease outbreaks. Definitely, it's going to increase demand for health services while impairing the system's ability to respond. That's a very, very important thing. How does climate change? How is it driving the risk? We are seeing a lot of climatic-related disasters. We are seeing cyclones because of global warming. We are seeing floods. It's estimated that for each 1%, 1 degree centigrade increase of global warming, there will be extreme precipitation that may intensify about 7%, of floods. We are seeing infectious diseases. It's estimated that by 2050, mosquitoes that carry vector-borne diseases like malaria will have increased. We are seeing wildfires. You may be aware of what was happening recently in the United States. Wildfires, we have seen this in Australia. Heat waves, you know what happened last year in the Sahel. We are seeing droughts, among others. So a lot of risks are being driven by climate change. You cannot talk about climate change without talking about the ENSO. Let me remove my video because it's becoming slow on my side. Okay, forgive me for that. The ENSO, as you may be aware, is a climatic phenomenon that has brought about a lot of changes globally. We are seeing respiratory tract infections increasing. We are seeing waterborne diseases. We are seeing foodborne diseases. We are seeing cardiovascular diseases, which are non-communicable diseases, food insecurity, among others. And all this is because of what is happening globally when it comes to climate change. So why do we assess climatic risk? You may be wondering, why are we discussing this? In order to adequately respond to the impact of climatic change in health of a population and the health system capacity, the first critical step is usually to assess which population, which geographical areas are most vulnerable to different kind of health impacts, but also the capacity for health systems. That's why we assess. So we assess, one, majorly to help identify potential climatic emergencies and their health impact. We want to plan prevention, preparedness, readiness actions, prioritize activities across the health sector. We want to provide the basis for health-based decision-making using consolidated multi-sector approaches. But most importantly, also want to allocate the limited resources because we have a lot of competing priorities. Now, in the health sector, we usually center our assessments around developing risk profiles. And majorly on the health sector, with the guidance of WHO, we use what we call the STAR tool, strategic tool for assessing risks. It's usually at strategic level, and it's done every 2 years. This informs contingency planning, which feeds into what they call the National Health Emergency Response Operational Plan, which basically feeds into the National Action Plan for Health Security, which is majorly the major framework for preparedness for public health emergencies. And ultimately, this feeds into the National Health Policy and bigger strategic plans. So I will go deeper into the attributes of assessing risks and developing the risk profiles. So the attributes of climatic risk assessment tools, here specifically using the STAR tool, is it must be owned by the country. So we have country ownership of the risk process and results such that it is easy to implement. You must have available data, secondary data, but to some extent also primary data. So you need to consolidate available data and information and apply a feasible approach. It's an all hazard based on real-time approach involving all stakeholders. It's adaptable both at national, subnational, and now we are going local. It brings multi-sectoral approach and a whole society approach, and the results must be well understood by the different stakeholders. There are multiple tools, but like I said, we shall focus on the strategic tool for assessing risks, specifically targeting climatic risks. Now, the key parameters that we usually apply are one, hazard identification, where you need to identify your risk and hazard, your hazard, not risk. You identify your hazard so that you can take it through a series of assessments. After identifying your hazard, you document and you articulate your health consequences of the hazard. We shall go deep into each of these. You then articulate your exposure. You need to have the identified affected geographical locations. You need to clearly articulate the likelihood of risk. You need to discuss the seasonality, vulnerability, and coping capacity of the community in line with this hazard. Like I told you, if you want to adequately respond to the impact of a climatic change on health of the population and the health system, the first critical step is to assess which population and geographical areas are most vulnerable to the different kind of health impacts, but also the capacities of the health systems. And all these parameters bring out that. Okay, so if we are to go step by step, identifying hazards, you need to list all the type of hazards, and you must include the climate-related hazards. For example, wildfires, disease outbreaks, floods. And this, like I said, is an all-hazard approach. So you bring all the relevant authorities, the relevant authorities to identify these hazards and support the decision making. But the most important thing is to consider hazards that are more likely to result in an activation of a national or a subnational coordinated response mechanism. And in addition to that, you need to consider the characteristics of these hazards in terms of transmission mode, case fatality rate, morbidity rate, while you're describing these hazards. You will now, once you have identified the hazard, for example, you have identified earthquake or floods, then you describe the health consequences. Now, health consequences are downstream effects that result from the hazard that contribute to ill health. And this can be physical consequences, they can be psychological, they can be health system impacts, they can be economical, and they can also be environmental. Please note that you cannot respond to the impact of a climatic hazard unless you have identified health consequences, because for us in the health sector, our major issue is to respond to the health consequences. So the countries may implement some of the early actions based on the health consequences identified during the risk assessments. And there are quite a number of actions. I will not go deep into that. Specifically for ENSO and El Nino, these are some of the health consequences that you can articulate to enable you come up with anticipatory actions. These include direct injuries and fatalities, vector-borne diseases, malnutrition, communicable diseases, waterborne diseases, RTI, mental health, disruption of health services, among others. The scope, of course, is definitely beyond this. So when you're assessing the level of consequences, please pick on the negative consequences that are, associated with IHR. Look at issues like whether the number of cases and death of this event is large at a given time, place, and person, if the event has a high potential public health impact, whether external assistance is required. This is some of the criteria that will enable you identify the hazard. When you talk of disruption of health services, you have to define what the essential health services for a particular country are. And essential services are usually determined by the Ministry of Health. So each Ministry of Health determines what they mean by essential health services. They may include, but not limited to, communicable diseases, non-communicable diseases, surgical procedures, maternal and newborn, services, adolescents, among others. So these are some of the criteria that enables you identify that. Then you go ahead and describe and assess the exposure. Now, for purposes of assessing the impact of climatic associated emergencies, you are looking at the people, the infrastructure, the capacities that are located in the hazard-prone areas. You need to consider the number of people living in the high-risk geographical areas that were identified in the previous step, and then the number of infrastructure located in the hazard-prone areas. How many hospitals are located in the flood-prone areas? How many hospitals or health workers are located in the earthquake-prone areas? That's for non-biological hazards. For the biological hazards, consider the people who would be infected due to their susceptibility to the pathogen. For example, if you're assessing the risk of malaria, which is climatic, associated, you want to know how many people who are susceptible to, to mosquito bites, who are living in a particular area that is prone to malaria. How many people are not utilizing, the ITNs? What is the proportion of people who are utilizing the ITNs? All this could help you come up with particular exposure figures. Affected geographical areas, you identify the areas that are, likely to be affected by this hazard that you have identified in the step 1. When you're describing this area, it can either be, urban, peri-urban, or rural, because all these have implications on your response strategies. Whether there's sparse, settlements, whether they are informal settlements, all these should be documented when you're assessing. When you're talking about the likelihood, you want to decide whether this hazard is more likely to occur, whether you're almost certain it will occur every year, whether it's very unlikely, the chances of less than 5%, whether it's likely, always whether it's very likely, and all this is dependent on the expertise that you have when you're dealing with this assessment. If you're almost certain that you will face a hazard in the next 12 months, then the likelihood scale will be almost certain for that. This is just a passing slide to show you some of the reference tools that they're currently using when they're considering likelihood during your assessments. When you talk about seasonality, you define it, you define each hazard, and you identify the months of the year where or during which the hazard is more likely to occur. And you use color codes when you're specifically using the STAR tool. So the experts may refer to surveillance data from the last 5 years. It will guide you to determine which month of the year you are more likely to have this hazard occurring. You can use historical data or emergency experience. You can use modeling, like what our colleague Dr. Polino has been talking about. You can use about the data regarding tourism movement, population, and migration patterns. Defining seasonality will allow you, one, to have better planning, including planning for your surge capacity. If you know that a hazard X is going to occur in September, you plan for surge capacity, for deploying surge, for deploying equipment, for prepositioning before the month occurs. It helps you in prioritization and implementation of timely and appropriate actions to mitigate this risk. It also helps you to scale up readiness capabilities to be able to respond, especially to imminent risks. For example, now in our region, we are facing EVD, an outbreak of EVD in a neighboring country. We have MVD in one of the neighboring countries. So it has helped us to scale up readiness capabilities for potential importation of this disease in whatever country you are, in a neighboring country. So it helps you as part of your planning purposes. Vulnerability, which refers to the characteristics and circumstances of an individual, community, or health system that make it susceptible to the damaging effects of the hazard. When you're considering assessing vulnerability, you look at characteristics of the population, such as immigrants, such as ethnic minorities, such as displacement persons. Consider other characteristics like overcrowding, substandard building materials, location, that may increase the susceptibility of the hazard. You refer to conditions of critical health infrastructure. Are these facilities located in hazard-prone areas, flood-prone areas? Is there potential of damage, roads, distribution of power? All these are lifelines that can affect delivery of health services. And then you also assess whether there are mitigation measures that are in place to address the identified vulnerability. Like I said, this is an example of climatic change vulnerability. Looking at the factors in the environment, looking at exposure factors, looking at health system factors. I will not go deep into this because we have already discussed this. But all this bring about climatic sensitive health risks that we have already mentioned and discussed. Vector-borne diseases, zoonotics, respiratory tract infections, heat-related, illnesses, mental health, among others. Then we talk about coping capacity, which are basically, when you're talking about coping capacity, you're looking at plans, systems, skills and resources, knowledge. These are attributes that will help you or will help the community cope, to be able to minimize the identified risks. And coping capacities are basically strengths and attributes of a system. They range from contingency planning, emergency funding, surveillance systems, social protection, search and rescue capabilities, presence of emergency operation centers, medical countermeasures, logistics and supply chain, among others. So once you have done that, then you come up with your assessment, and then you agree and say, shall come up with key actions that will enable us to plan for the next 3 months, or 6 months, or in long term. This is just an example. I conclude. For example, if you have identified flood as your high-risk hazard, you have identified your areas, which are the hotspots in the districts. You have identified your vulnerability, and you said it's moderate, and maybe you have identified your coping capacity as low. You come up with key actions that are risk-informed, that should be able to mitigate the negative impacts of the floodings. For example, you may come up with an action to say you want to review and update your current contingency plan for flood mitigation by the national disaster authorities and health authorities. You may want to, review after conducting a simulation exercise, which will help you to come up with key gaps of competences of the area that you want to address. You may want to develop SOPs and MOUs across national and state levels during the flood season or before the flood season, part of readiness. You may want to increase social awareness and implement housing and planning, mechanisms regarding floods and disaster susceptible areas. You may want to bring in your RCCs. You may want to review your community early warning systems and evacuation routes way below the season of flooding. You may also want to review, as a long term, your health infrastructure located in flood-prone areas. I know there are some countries that have reviewed this following repeated floods and have mitigated this by, building the health infrastructure in areas which are not flood-prone, or advising people and the population to move away from the flood-prone areas and go to areas that are better protected. We have also seen areas where member states have revised and improved their infrastructure that are located in the flood-prone area, such that when floods occur, they are not cut off during the flood season. So the key takeaway, as I conclude, is consider using an all-hazard approach, a multi-sectoral approach, to better understand the interactions between risks and identified high risks for planning. Predictive climatic models and forecasting information should be consolidated into systematic assessment processes to improve understanding of risks and all its dimensions. We are looking at health consequences, affected geographical areas, exposure, vulnerability, and capacities. We need to integrate climatic health impact assessments into our existing comprehensive risk assessment methodologies. For example, the current STAR, and that's what we are doing now, to ensure sustainability and enhanced integration of risk-informed actions into existing national planning processes. And also, we need to have very clear predetermined objectives for risk assessments so that we're able to inform development of 5-year national plans, but also have, climate impact response frameworks. Now countries are also going in for climatic adapted response plans, and also plan and ensure that we update our multi-hazard response plans on an annual basis. So this is what I had to say. Thank you very much. Over to you, Mr. Chair.
Thank you very much, Dr. Allen. Colleagues, as I promised, is going to be a very exciting and informative talk. So you've heard first about the broad models that predict climate, season, and now you've heard about ways of assessing the risk specifically to the health sector and even very specialized around health security and emergencies. Please, I remind you, put your your questions not in the chat box, in the Q&A. They will be answered live as we go along. Some have already been answered. But if you have more questions, you also wait for the Q&A session and you can ask directly. So after that, very big and important broad talk about how nations are to plan, we will get some very specific actions for planners on specific scenarios of climate hazards. So we'll hand over to Dr. Alice to give us natural hazards, specific anticipatory actions. Over to you, Dr. Alice.
Thank you, Dr. Ibrahim, Dr. Allen, and Dr. Paulino for the nice presentations. So I will just continue from where Dr. Allen have stopped about the STAR. So most of us in the country offices have conducted a STAR risk assessment using the STAR tool, and all of us were able to get, or the tool were able to generate what we are seeing on my screen, which is the risk calendar. As you can see, we have, this is actual risk calendar from one of the countries. Of course, we cannot name the country, but you can see that the country have identified cyclone as drought, earthquake, fire, floods, food poisoning, and heat waves as their hazards or risk. And as we can see, cyclone has been identified as a very high risk level. And if you see across the calendar, January, February, March, and April are red, meaning these are the months which this hazards is going to start, or it may happen. It may happen or it may not happen. And June, July, August, and September, these are the green months where these hazards may not, or this risk may not happen. So what we do as readiness or preparedness is that in this month, the green month is where we should start strengthening our preparedness and readiness for this identified hazard. So by doing that, in the Afro Regional Office, most of you have seen this. We have this form on my left, which is your right, This is an online form for assessing risks. We call it the Natural Hazard Readiness Checklist. We have it for other hazards also, but for this presentation, we're going to focus on the natural hazard. So we usually share this checklist with countries, and it is their countries which assess themselves by filling this risk. And immediately by submitting the form, we are able to receive at the regional level in our dashboard this analysis. So this is what we received from few countries in 2023 when we are trying to assess their readiness capacity for cyclone preparedness and readiness. So as you can see, we are having some capacities, or some areas are in green, which are well developed, some are in yellow, which are intermediate, and most of it are in red, which is meaning that those are areas which need a lot of development of capacity. So for us to be able to address those red or those gaps which have been identified by using these readiness assessments, we have anticipatory actions for natural hazards that we usually share with countries. And because of this webinar, I'm going to take you through some of the minimum readiness measures for priority countries. So what should we do in terms of readiness or preparedness for natural hazards in coordination? In coordination, countries should conduct risk profiles, and they should develop, if they don't have, or if they already have multi-hazard plan, they should update the multi-hazard plan before the hazard happen. Also, countries should establish functional multi-sectoral coordination mechanism, both at subnational, local, and national level. And based on your countries, you know if you may need external support or not, but also in terms of readiness and preparedness, you have to streamline your external support mechanism, also allocate and activate contingency funding for national and subnational levels. You have to map your partners and resources using the 4 Ws. Where are they operating? What do they have? And also to ensure communication among local and subnational national authorities and health facilities is to make sure that health facilities is well functional. And lastly, to develop and update the gender-based violence and prevention strategies. For surveillance and early warning system, what we should do as part of preparedness and readiness for natural hazard is to make sure that the early warning system is well described and functioning, and it is also linked with the weather early warning system. We know that in the countries in some countries is under the Ministry of Humanitarian Affairs, is based on what is available in your country, but they also have the weather early warning system. So we have to make sure that we link it with our health early warning system. And also we have to make sure that the facility-based surveillance and the event and community-based surveillance are well functioning, and they are ready to continue the surveillance activities in case of any emergencies. And lastly, to conduct CMEX or tabletop exercise to test the plan and the response plan that we have developed. For health service delivery, we have to develop or update, in case you have it already, the National Emergency Response Plan. You also have to map your communities or the sub-national areas at risk. We know that in our countries, we already have identified where is the flood going to start, where is the heat stroke is going to be. So we have to map the subnational area or the high-risk area, depending on which hazard we are facing. And also we have to assess the at-risk health facilities within these at-risk areas and determine if the HR capacity needs are ready for emergencies. And lastly, to ensure the communities continue to have access to primary and secondary health care. In this one, some countries are using the mobile medical teams or the rapid response teams. For rapid response teams, we have to make sure that the emergency medical team, rapid response team, and AVOC search responders for the countries which already have it are trained and they are available for deployment to respond to emergency needs. Also, we have to make sure that we have trained and maintained the search and rescue teams. In terms of flooding and drought, we will need these search and rescue teams, and also to conduct capacity building for the community healthcare workers to respond in the event of emergencies. For risk communication and community engagement, what countries should be doing is to make sure that the early warning and risk communication are well established and it's functioning up to the community level, and also to prepare community to effectively cope with the events and manage the post-event recovery. And lastly, social mobilization and risk communication for at-risk communities. For OSL, we need to preposition contingency stock in the high-risk areas. We know during floods, accessibility may be an issue, so it's important for us to preposition the supplies before, and also to make sure that we have a well-functioning supply chain to support timely emergency response and to ensure availability of contingency stock, which trauma kits or other kits for response based on the associated risks. We have to make sure that we have this contingency plan ready, and also to conduct a rapid logistic assessment to identify the potential gaps in logistics for the health sector and to bring the partners on board for them to cover the gaps that have been identified. For case management, we have to identify designated health facilities which will be able to receive and treat trauma cases during and post-response. Also, we have to establish a functioning referral system and to develop SOPs for patient referral. In case the facilities in point A is all damaged, we have to make sure that we have this referral system functioning. We also have to designate health facilities and trauma hospitals, which are well staffed, including well-qualified surgical staff in case we need them. And also we have to make sure that the health facilities are well equipped with trauma kits, and that we have prepositioned cholera test kits and rehydration supplies. And lastly, to make sure that we have trained the health facilities on the management of mass casualty events. For laboratory, we have to update our lab SOPs for collection, packaging, and transportation of samples. And we make sure that we share these SOPs with all the labs in the high-risk areas. We also have to estimate the amount of laboratory supplies and consumables that we may need according to the population of the population in the high-risk areas, and also to proposition or to procure in case we don't have it, and to establish a rapid transportation system, courier services, and to make sure that we have standby agreements with WHO collaborating centers in case we have to ship samples outside, to conduct simulation or exercise or TTX to test the coordination and the testing capacities of the lab, and to make sure that we have a search plan to increase the testing capacities in the affected areas in case we have shortages when the event happens, and also to train sufficient lab staff on sample collection, transportation, and testing. For point of entries, we have to identify and fully equip the point of entries in these high-risk areas, and to make sure that we train the staff at point of entry. And also we have to identify the point of entries in the high-risk areas, and we link it to the national surveillance system. We don't want the point of entry to have a standalone surveillance system. It has to be linked to the national surveillance system, and to make sure that the screening activities are in place, and to develop a costed contingency plan for point of entries in these high-risk areas. Also to make sure that we have prepositioned posters and leaflets, and to identify a referral health facilities for each point of entry, a nearby health facility or hospital as a referral hospital for the point of entries. For IPC and safe and dignified barriers, we have to ensure that the health facilities in the high-risk region meet the minimum requirement of IPC program, like having the IPC focal point guidelines, SOPs, the health workers are trained and all these things. And also to make sure that the IPC task force for hazard-specific readiness and response is in place, and that the strategy, the IPC strategy also has been developed and is ready for implementation if it's not been implemented already, and to develop plans for such capacity and IPC resources in case we need it, and also to train community-based volunteers to conduct household disinfection and STP in the high-risk areas. For wash and food safety, we have to make sure that the latrines in the high-risk areas are functioning and it's having a functional hand hygiene stations, and to train the community volunteers in IEC messaging and on hygiene promotion, and to also update and preposition wash protocols and guidelines. We have to make sure that safe and sufficient water is available for the community, and also that we have access to safe drinking water, and to also conduct sanitary inspection of key wash infrastructure and conduct repairs which is when it's needed, and also to designate and train officers for food safety in high-risk areas, and lastly, to establish a functional medical waste management system. In psychosocial support and mental health, this is a very important area during these emergencies. We have to make sure that we incorporate it in our preparedness and readiness. We have to identify mental health professionals for deployment to affected areas, also to activate the community-level psychosocial support system, including peer support groups, because the communities feel more comfortable talking to each other, and to preposition psychosocial first aid materials in the shelters and the response centers, and to make sure that we plan and launch mental health campaigns to reduce stigma around seeking help. We have other areas which are cross-cutting areas, is not necessarily health areas, but these are also areas that we have to make sure in preparedness and readiness for this natural hazard, that those ministries and all line ministries and also the partners, they are also ready. We have shelter and settlement, governance, legal framework, environment, risk management, energy and telecommunication, education and child protection, economic and livelihood resilience, and urban infrastructure and resilience. Those are cross-cutting areas, but we have to work with our partners to make sure that they are also ready for this natural hazard. I will stop here. Thank you, and over to you, Chair.
Thank you very much, Dr. Alice. Participants, so we've heard that climate events and hazards are going to be occurring at higher frequency. We've heard that it affects directly as well as through other intermediate means, including increasing levels of vectors, waterborne diseases, food insecurity, and others. And finally, very early in the year now, you've been given a whole list of very specific actions that need to be taken for the operational readiness to these climate and weather-related hazards and events. So we're going to go to the Q&A. Several questions have already been answered in the chat. However, I'm going to look for hands, and then I'll come back to any that still are pending in the chat. So I can see a hand from Muzala Kapina. Can you please, when given the access, unmute and ask your question? Muzala, you have the ability to unmute. Please speak very loudly and be concise. Over to you, Muzala. Muzala, can you unmute yourself? Muzala, are you able to unmute yourself? Okay, I see your question asked in the chat. So Muzala is asking, there are so many models out there and many may be more applicable to certain settings and not necessarily everywhere. Is it possible for the panel to give more specific information for particular regions? Okay, so I think I'll throw this question to Dr. Paulino. If you can talk to Muzala about some specific models that may be better for or more suited for some particular regions.
Thank you very much. Yeah, it is very important also for us to note the application of the models are different from sector to sector. One model can work very well in a certain region, like for example in Kenya. It's not necessary to work well in all different parts of Kenya. Therefore, putting into account the validation processes of the model for you to know which model is accurate, you have to look into many validation metrics, and also many scientists, they are using different data sets for them to validate. Sometimes you find variation in the model. Also, if you look at the model being used in forecasting, the skill different from the regional model using climate change or the CMAP6. For example, last year, I published a paper to validate 26 CMAP6 used by Intergovernmental Panel on Climate Change and also IPC processes. So I validated this 26 CMAP6 model, and I ranked the best 10 perform in the East Africa region. Then you find also the one perform well in over South Sudan, not necessarily to perform very well in Kenya. So what I want to say for now, if you are doing application for health application specifically, it's better for you to use the WAF model, which is used for prediction. If you want to do the climate change analysis assessment, now you have to use a regional climate model, RCMS or GCMS, which is a global climate model. So you have to look into different paper. Like now, the 26 model, the one I validated, you find them working very well over East Africa. But some of them also, in general, when you detail into the specific region, you find it's not performing well. So really, it's not a straightforward selection for you to say this model is working very well. So you have to look into many aspects of it and also many variables. Sometimes the model captures very well the pattern of rainfall. It's not necessary to work for temperature or relative humidity or any other meteorological parameters. So I will put the link for that paper for those who want to do climate change analysis. We ran the whole model and we selected the 10. These 10 are best from 50 screen it, and then we also select 26. After that, we select 10. So based on your country now, you will be able to see which one perform much better. But for the purposes of forecasting, prediction in a short term, the WAF model already validated in different countries. All meteorological departments are working on it. So if you are coming from Kenya, you have to go to Kenya Meteorological Department for you able to get output from the WAF. If you are from another country, Uganda or any country in Africa, you have to go to Met Services because they did customized studies on your country. The one work for East Africa in general may not also reflected in your specific area of application. Thank you.
Thank you, Doctor. That is a very interesting analysis. I'm looking for more hands. I don't see any hands. Let me go back to the Q&A. Okay, there's okay, let me ask, there's an interest from Bilha. I think this is a follow-up question to an earlier question, so it may be answered in the chat. Bilha is very interested in doing the modelings. This is great. I still see a hand from Muzala Kapina. Is this a legacy hand, or if you can talk now? I think we've answered the question you put in the chat. There was a very important question I saw from Funsani. If we're able to predict, why do we still have devastating floods, fires, which we can see, and thus we could prevent? Paulino, you've answered. I think from our end also, we know that a lot of data is out there and predictions are sent proactively by many meteorologists, climate centers, and departments. The problem we see with countries really is using information for planning and action. There are many meteorological agencies that even publish and send to other ministries, departments, and agencies in the government a whole year's predictions of month-by-month occurrences that will happen, including some of the health impacts. But some of these documents stay on the shelf and gather dust. While from our health security side, we have very, very important plans that countries are helped to develop. Dr. Allen listed quite a few of them: multi-hazard plan, you have your national action plan for health security, you have your hazard-specific contingency plans, you have One Health plans, but it then becomes a question back to countries. Why do you have these documents and you have these predictions and they are not implemented in time to save life and reduce suffering? So this is back to countries, and this is the reason why we're having these kind of webinars to further add fuel to your ability to utilize what it is that we have out there. I'm still looking for hands. Muzala, this still looks like a legacy hand. Kindly put any query you have within the Q&A, not within the chat. We also have a question in the chat around the importance of this subject, and is there a collaboration with Africa CDC in the region? And Paulino has answered to the affirmative. There's actually a strong collaboration ongoing within the region. I'm looking for final time if there's any burning hands with any further questions. Please, colleagues, be rest assured that the presentations are going to be shared with you alongside the recordings. And there's several links that will also be shared around the SOPs, guidance documents. Our colleagues from IGAD have a very, very proactive alert system that can send you, when you register, information on predictions, and this is key towards getting early warning. So we try to encourage colleagues to please register for these tools. Ask in your WHO offices in the countries of the plans that you have, whether they be multi-hazard. Your STAR reports are giving you a season by season, month by month, look at what are your high risks. And very likely, if you go for the health part to your ministries of health, you will find that there are some plans around hazard-specific contingency plans. There are readiness checklists that have been filled, and there are multi-hazard plans. Please inquire in your ministries. So I will take it back to my panelists. If they have any final concluding thoughts, I'll start with Dr. Paulino, then Dr. Allen, then Dr. Alice, and then we'll bring this session to conclusion. Dr. Paulino, any final thoughts? Dr. Allen, any final thoughts?
No, just to thank you and thank the participants, and just to emphasize that the reason why we do assessments is basically to help member states to be able to predict, plan for, public health emergencies, and also plan for contingencies. Just without knowing what hazards you want to respond to, it will be very, very difficult for you to scale up in terms of readiness and preparedness. But most importantly, it will be very difficult for you to minimize the public health impacts of these climatic-related emergencies, because it may be very difficult to prevent them. Yes, but as the health sector, you need to know what are your health consequences that you are going to deal with, such that you prepare, you plan, prepare, and be able to respond to them. So thank you very much, and yeah, that's all from my side.
Dr. Paulino, you were silent for a second there. I don't know if you have any final thoughts, concluding thoughts.
Sorry, I dropped out. The internet also has some issues. I'm not sure if there is any question been asked while I was out. If no any question, also from my side, I just want to appreciate your team, enable moderator, Dr. Ibrahim, Alice, and Alan, other colleague, and many people also behind this successful webinar, especially our sister Amarashi. Sometimes I pronounce her name so difficult for me. Yeah, just appreciate you, and also let us continue working together for benefit of our region and beyond. Thank you very much.
Dr. Alice?
Thank you, moderators. Thank you, my colleagues. So for me, it's just to emphasize that, as Dr. Alan said, it's important for us to do readiness and contingency planning. And because of that, we have been sharing the link to the form, the checklist, the readiness checklist for the hazard is specific with countries, but most of the time we don't get feedback. So from this webinar, you have understood or you have seen how much is it important for us to fill this checklist, which will guide you to update your contingency planning and also to strengthen readiness for these hazards. So I just urge you to fill those things, and if you need these forms, you are not able to have it, you can just contact our country offices because we always share with them. So I just want to say thank you, and sure that we are going to have more webinars all related to climate, and we're going to have more partners on board. Thank you, Dr. Paulino, for joining us.
Thank you to Dr. Alice and all our esteemed panelists. So you've heard it all, colleagues. You can reach out, and we shall be sharing these materials via our training units. You can reach out also to the WHO country offices for access to the readiness checklist and other materials that we've described in this meeting. One thing that struck me is when all colleagues were talking, there was a lot of talk about migrations and movements caused by these hazards. Just to highlight to colleagues that there's also going to be a webinar series coming up on border health points of entry to boost capacities at these very important stops in the human migration pathway. Just a reminder to our Francophone colleagues also, there will be a French version of this webinar that will be organized and will be shared with you accordingly. Thank you, though, for staying with us. We're ending now. At a stage, we had over 106 participants, so we are very happy with the turnout. Colleagues, please stay tuned. We will be sharing links to future climate-related webinars. So thank you for joining us until we communicate and convene again. Over and out.